of TCM. First of all, we will offer our respectful gratitude to Khimka sir, AP Agrawal sir, and all the ASPSU team. We will begin with the prayers. वह शक्ति हमें दो दयानिधे कर्तव्य मार्ग पर डट जावे पर सेवा पर उपकार में हम निज जीवन सफल बना जावे हम दीन दुखी निबलो विकलो के सेवक बन संताप हरे जो है बिछुड़े भूले भटके उनको तारे खुद तर जावे छल देश दंभ पाखंड झूठ अन्याय से निशिदिन दूर रहे जीवन हो शुद्ध सरल अपना शुचि प्रेम सुधारस बरसावे निज आन मौन मर्यादा का प्रभु ध्यान रहे अभिमान रहे जिस देव भूमि में जन्म लिया बलिदान उसी पर हो जावे वह शक्ति हमें दो दयानिधे कर्तव्य मार्ग पर डट जावे वह शक्ति हमें दो दयानिधे कर्तव्य मार्ग पर डट जावे. Okay, so we will begin with the today's session of treatise for Dr. Voll's Electro Acupuncture. We will begin from page number 66, that is chapter number 6, Heart Meridian. There is lot of things to learn here in this chapter, 6th chapter. All these chapters now, 6, 7, 8, 9. So the location, it is same of heart meridian in Chinese acupuncture. This meridian starts under the bone of third ribs corner above the pre-axillary line and goes to the root of the nails, ulnar side of the smallest finger. Okay, I think it's not ulnar finger, it's a ulnar side, it's a radial side actually. Yeah, it's the smallest fingers, radial side. I think it's a printing mistake. It's not ulnar side. Ulnar side is this side. This is ulnar side. And inside, this is radial side. So this is the radial side actually. Okay. Number of points in the heart meridian, there are actually 9 points according to TCM, but here 17 points. So 8 points are newly found out, newly discovered. In that we can see H8C. This is the CMP of the heart. H8C. This is CMP. It's main point. And you can see below H6A. This is the SA node or pacemaker. This is the MP for sino-auricular node. You might be knowing, according to in BHB, you have seen that. What is meant by SA node? What is meant by AV node? These are the structures where the impulse generates in SA node, specifically sino-auricular node. Here it is called as a pacemaker. It generates the impulse and it spreads out to the AV node, then bundle of His, then left and right bundle branches of His. Is the His system, HIS. So because of that only, that impulse goes forward, and because of that impulse, cardiac muscles get contracted and expansion it happens because of that impulse. So that is the main function of this SA node and AV node. SA node basically pacemaker. So this H6A, this is very important point for this function. It is given there. It is possible to treat serious diseases of difficult parts of hearts with these new 8 points. H6A right side is the point for pacemaker. Putting one star magnet on this point functions as pacemaker for the patient. H6A, H6A here it comes here only on this side. So you can place one magnet here, H6A star magnet. It works like a pacemaker. Nowadays, suppose this SA node is not able to generate the pulse. So there are so many different problems. Means conduction system gets impaired of the heart. So heart's working stop. In such cases, there is an urgent need to fix the pacemaker by surgical interventions. So cardiac surgeons does this it's very common to fix the pacemaker, to generate the impulse. So rather than fixing the pacemaker is one small device and they used to put here just near to the heart, somewhere here or below the rib cage, like above that, below the skin. They used to place there, or sometimes here, that is pacemaker is in, and its connection is going up to the hearts. That's about. So it causes the impulse to generate. So rather than fixing and going for that surgical intervention, this only 5-star magnet or small star magnet is enough to replace with this pacemaker. You can put it here exactly on the place of H6A that works like a pacemaker. Now, some points they have mentioned in the point number 2 at page number 67 about the different walls. There are how many walls are there in the heart? Can anybody tell? How many walls? So there are 4 walls. 2 are this tricuspid wall and bicuspid wall or mitral wall, and one is the pulmonary wall, where the blood from whole body goes into the right atrium, and there is a pulmonary wall goes from the right side of the heart, means right atrium goes blood goes into the right ventricle. From right ventricle it goes into the lungs for purification or oxygenation to get the oxygen. There, that place, their pulmonary walls are there. And one is at the aortic wall, when blood from the left side of the left ventricle goes to the body, aorta. There is an aortic wall. And in both the chambers, on the right side and the left side, right atrium and ventricle, right left ventricle, right left atrium and ventricle, there is a tricuspid and bicuspid wall or mitral. So for the proper functioning of those walls, these H9 right side for pulmonary wall, H9 left side for aortic wall, H8 right side for tricuspid wall, and H8 left side for mitral wall. These are very specific points which can be used to correct the functions of these walls. Now H7 is specifically used for His conduction system. Now we have seen SA node, AV node, then bundle of His, and from bundle of His, the His conduction system, both sides, right and left branches of the His bundle branch. Now H6 for the myocardium. With these points, now the treatment of different walls and ventricles is easily possible. Okay. Now flexuses. These are the cardiac plexus, coronary plexus, and cardiac ganglia. These all are the flexuses which innervates to the heart. Treatment on these plexuses make the nervous system of heart work properly. Okay. Again, the HHC is the control measurement point. This is very important for all the functions. Now 5th point, 6th point, you can do it out. 7. It's the same thing again. Lymph vessels, all the subendocardial, myocardial, pericardial, all the lymph vessels. Some important facts about heart. Heart is frequently blocked by mercury. Again, the pathology is given. Reasons because of which chemicals the heart functions is deranged. Distortion of cardiac ganglion may cause slow heartbeat, palpitations may weaken one or more walls of the heart. So we have two movements. The diagram is on the 69 page number. See, diagram is divided into two parts. One is the palmar side, on this palmar side, and one is the dorsal side. The palmar side, it is given inside all the points shown in the diagram. CMP is 8C. Okay. Next page, page number 70, heart meridian. Now we can see here. Heart meridian on the H9. H9 on the right side. H9 on the right side. Here. Inside. The right hand upside curvature. That is for the pulmonary wall. MP for pulmonary wall. On the left hand, left side, it's for the aortic. Because pulmonary wall is on the right side of the heart, and this aortic wall is on the left side. Aortic wall has three segments at the junction of the aorta. It's a seminal wall, and it has a two right ventricle. Function of an endocard of the right ventricle with pulmonary wall can be measured. Again, next point, H8F. It's a subendocardial lymph vessel net, MP. Then H8E. It is an autonomic innervation point for cardiac plexus. Again, the same thing. Autonomic innervation. The sympathetic portion is a method of balancing autonomic steering of the heart. H8E, cardiac plexus. Along with that, you have to treat UB10A, B, and C. The upper, middle, and lower cervical ganglion, CI7A. We have already seen coronary plexus of the heart. It's an important point. CI7A, circulatory meridian, circulation meridian. So vagotonic portion, ST16, 18, and 15. Okay. Then H8D, MP, myocardial lymph vessel net. H8C is for, it is a CMP. H8C, it's a CMP of the heart. Then H8B is MP for endocardium. Then H8A, MP pericardium and subpericardial lymph vessel net. And H8, so the right side, left side. Just wait a minute. Yes, we'll resume. H8, point number H8. On the right side, it is the MP of tricuspid wall, and on the left side, it's the MP of mitral wall. Okay, tricuspid and bicuspid. Now, tricuspid wall on the right side, it controls the opening of the right auricle to the right ventricle. It on the left side, it controls the opening from the left auricle to the left ventricle. Here, function of the right atrium with tricuspid wall and papillary muscles and chordae tendons is measured. Here, functions left side, chordae tendon. What is meant by chordae tendineae? Can anybody tell me? In BHB class, cardiovascular system, you might have heard this term, chordae tendineae. What is meant by chordae tendineae? Can anybody tell me? These are the thread-like, actually, these are the thread-like structure, strings. These are called the strings, which are connected to the cardiac muscles, to the papillary muscles of the wall. Aortic means all the walls of the heart. Walls is this structure. Walls are the papillary muscles, and from there, it is a string-like structure which is connected to the heart muscles, cardiac muscles. That is called as a chordae tendineae. Now, if this wall is affected, there may be twitching or contracture of the little finger of the right hand. Means this is the significant symptom, sign in our body that if our tricuspid wall is somehow its function is deranged, then our right ring, this little finger, is being contracted, or this twitching happens in this ring. So it is the indication of something is happening in tricuspid wall, and if it is happening left side little finger, then it is mitral wall problem. Okay. Then now we will go ahead at the page number 75. This is H7A. Right side MP for atrioventricular node, AV node. It is situated in between atria and ventricles, atrioventricular node. On the right side itself, partial heart block may be due to delayed conduction of for AV node with increased PR interval. Do you know the PR interval? It is actually to see the function or the conduction system of the heart. There is a specific investigation which is called as the ECG, electrocardiogram. And electrocardiogram has 5 types of waves in that. There is a P wave, then Q, it's upside, Q, R below, S, and T wave. This is a PQRST, it's a complex PQRST. These are 5 types of waves. So from P wave up to the R wave, Q is in between and R wave. That interval becomes increased so that it gives the indication that the conduction of the impulse is delayed from the SA node to AV node. And from AV node, it is delayed up to the throughout the heart, different chambers of the heart. So that's why it's very specifically mentioned partial heart block. That is what is a partial heart block. May be due to delayed conduction for AV node with increased PR interval. So you have to correlate all the things by measuring that PR interval in ECG and all that. In the first stage, the PR interval increases, but in the long run, P wave appears without QRST complex. Only P waves are attending. Means what happens once heart's conduction system gets impaired, it is not giving the impulse, but impulse is generating from the SA node, but it's the conduction system from AV node. It is not going to the bundle of keys and all the branches, both the branches of the bundle of right and left. So that whole heart is not properly functioning and properly contracting or expanding. That's why this is called as a partial heart block. This is partial heart block. So in ECG, only P wave is appearing, but QRST complex is not appearing. Only P wave, then some interval going on, going in between, and then again P wave comes, again P wave comes. It is like that. So this is to see the ECG. We can take a class on ECG also if you are interested one day. On the left side, it is MP of left branch of the bundle of his. Yes, left branch of the bundle of his. This is a measurement point for that. Then H7, his conduction system of right side and his conduction system of left side. The left and right, H7. Yeah, if weak pulse is accompanied by missing pulse, disorders of the rhythm, then treat H7. Yeah, that is the disorders of the rhythm are also can be diagnosed through this ECG, electrocardiogram. Different impulse is generating, but in somewhere it is missing. So missing pulse is also the symptom. H6A. Next point. On the right side, it's a MP for SA node. That is a pacemaker. It's main point. We have seen already. Left side MP for left side auricular one. Okay. Then on the next page, come to the page number 76. If SA node is hyperactive, the cardiac rhythm will increase. What is meant by increased cardiac rhythm or pulse rate? Increased pulse rate is called as
Tachycardia.
perfect. Very good. And if SA node is hypoactive, the cardiac rhythm will decrease, causing bradycardia. Partial heart block may be due to delayed conduction system. Correct. If no impulse is generated from SA node for 1 or 2 beats, there will be missing beat. Again, missing beat. So in such cases, what to do? Putting a star magnet on H6A, right, sometimes functions as a pacemaker for the patient. Here, you can see in the diagram H6A. Yeah, the position is just below the wrist joint. H6A. Same. Okay, then H6 on the right side, it's MP for myocardium. Any problem to the myocardium? It's the main muscle of the heart. Left side, MP for myocardium. Left. These are the cardiac muscle. Again, we have seen in the circulation meridian, CI7 is for the coronary vessel supply, and LY5 limb supply of epicardium, myocardium, and endocardium, all the heart muscles. Okay, then alarm point for the heart is CV14. We know the alarm point is of 2 types: the front shoe and back shoe, or front move and back shoe. So this is the front move alarm point, CV14. Where is the location of CV14 exactly? Umbilicus is which point? Center of the umbilicus. CV8. So above that one could CV9, 10, 11, 12, 13 and 14. It is just at the pit of the stomach. Just pit of the stomach is CV15. Below one kun of the CV15, that is CV14. That is alarm point for that. Deficiency at H6 may cause myocarditis. Some information. Okay, so this ends our heart meridian according to Dr. Voll. So next chapter.
I want to ask, where will all these be plotted on the Voll meridian? Is it only on the main meridians that we have these points?
No, I'm not able to understand. What is your question?
So the points 6A, are there the new points which Dr. Voll has said? Where will they appear in the Voll meridian?
In a pure therapy?
No.
Should we apply it only in Voll meridian or at an original points? She's asking like that.
No, you can use on original points also. No problem. You can directly apply the star magnets. You can apply.
Sir, is there Voll points for this too? For EAV too?
Yeah. But what happens generally, these according to Dr. Voll's, these points are generally you should place on the actual positions here only. Up to these points, like on the hands and on the feet, on the dorsal aspects, or here.
So these are only on the original then?
Yeah, original, yes. Original are more because these are also present in the Voll meridians also. We can find out Voll meridians 6A, 6B, like we can find out the points there also. But the more effectiveness is on the actual meridians, this on the body parts.
So what should be the size of the magnets which we usually use?
Yeah, if it is a bigger area, means suppose it is here or something like thighs and here, so you can use the bigger size, 3 or 4, Voll 3 or 4. Otherwise, Voll 3 is okay, I think. 3 or 4 is okay here also. And if it is on the finger, it's a very smaller points, then usually we are using that Voll 2, I think. Voll 1 is Ayurvedic acupressure we are using for, and Voll 2 is usually we are using for this Voll meridians.
Right.
So you can use the points on the fingers specifically, and even backside of the this dorsal aspect of the palm, this hand. We can use those same magnets, Voll 2 size. If it is below the wrist, then you can, it's a bigger surface area. So you can use 3 size or sometimes 4 size. Because the more muscle mass and fats are there also, no? The below wrist up to the elbow and above on the body. Here no the fats and muscles are not much more in comparison with the body. So more power it will require. So 3 number or 4 number beyond is okay. Okay, we will go ahead. Page number 77, chapter number 7, small intestine meridian. The location, both EAV and Chinese acupuncture, location of small intestine meridian in the beginning is the same. This meridian starts from the lateral side of the root of nail of small finger of hand, goes to middle of the lobe of ear. Yeah, it goes actually in this SI meridian goes from the back side of the shoulder up to the back side of the neck, and from neck it comes onto the here. Means it enters into the angle of the mandible from the below of the neck, below of the ear lobe, and it enters into the face actually. But it says that this Dr. Voll's small intestine meridian ends in the middle of the lobe, ear lobe. This is the ear lobe, the middle part of the ear lobe. Ends. You can see in the diagram also. Now it has a 29 points total, because in Chinese, according to TCM, in small intestine meridian there are 19 points, but here 10 points are newly discovered. Now we will see the specification. This SI1B is the CMP for small intestine. We have to know this. Then different points are given. You can read it out. Then 14 points are redefined here. Which are they? This is SI1. Specifically, it is also mentioned in some acupuncture books that SI1, SI2, SI3, SI4. These are for the ilium, duodenum, jejunum, duodenum, flexure, jejunum, ascending portion of duodenum, secondary. Means the 3 parts of small intestines are there. You might be knowing that duodenum, jejunum, and ilium. In that, ascending and descending portion of the duodenum is there. Flexure of duodenum is there. So if you will study thoroughly in BHB about the small intestine structure, so you can know if exactly problem happens in the duodenum part, so you can use this SI2. If it is in ilium part, SI1, then jejunum, SI3. It is like these points are divided. Then this specific point for cervical vertebra. Any patient with the cervical spondylitis or cervical or stiff neck or cervical spine related problem, you have to use this SI6 number part. Very useful part. SI6, then SI7 for nerves of the upper extremity. Then you might be knowing this elbow joint SI8 because it original point is here only, where we get a shock-like sensation. It's a nerve is there. Then SI10, third MP shoulder joint, SI18. Okay. Next point, in the third point, in small intestine meridian, SI1B is the control measurement point. It corrects the irritation of duodenum and small intestine and improves the functionality of small intestine. Any derangement in the function of the small intestine, it corrects this SI1B, 1C. Oh, sorry, 1B. There are 3 parts of small intestine. First part is called as a duodenum, then second is the jejunum, and third is the ilium. All related problems are solved here with the different points. Okay, the right side, SI1-1, 1-1, 1-1, SI1-1, left side. Okay, then yes, one formula is given here, one protocol of appendicitis. SI1 left and right, SI1-1 left and right, LI4 right, LI4A right, and SI1C right. This is during the attack of appendicitis. You can use this one. You have to sedate this during the any anywhere during the infection or during any attack of the pain, you have to sedate the point, and after that phase goes on, you have to tonify the point. All the points should be tonified. Now you can see on page number 79, the last few points. In Chinese classical acupuncture, the small intestine and the nervous system are interrelated. See, small intestine's functions and the brain, means nervous system, is interrelated to each other. So function disturbances in any part of duodenum or small intestine affects the central nervous system. In such case, treat duodenum and small intestine. Okay. Now come to the next page, 80 number, small intestine meridian. We will see the functions. SI1 on the right side, on the left side. It's the MP for terminal portion of the ileum. It's MP for ileum, left side. Now this is the diagnose and treat the appendicitis. Again, the same points as mentioned here. In chronic appendicitis, controlled by Li4A, right side. Chronic appendicitis. Again and again, the appendix problem is happening. Then treat SI1 right and left in leukemia. What is meant by leukemia? It is a type of a cancer actually where WBCs are not, it's a too much production of the WBCs. It's leukemia. Then SI1-1 is again MP or lymph vessels. Is come to the next page, 82 number. SI1A on the right side, mesenteric plexus. These are the lower and upper mesenteric plexus, right and left. All these small intestine parts, ascending, transverse colon, ovary, cecum, ileum, jejunum, pancreas, duodenum, all these are, all the lymph is collected here only, mesenteric plexus. Then SI1A, right side, controls and balance supply and excretion of biles in duodenum. SI1A. It controls and balances supply and excretion of the bile in duodenum. So you might be knowing in anatomical structures, bile duct combines with the pancreatic duct and it enters into the duodenum part of the small intestine. So it is also controlling the bile secretion, excretion or secretion of the bile. It balances that, it controls that balance mechanism. SI1A. Now SI1B, it's the CMP or small intestine. Again, one last line, treat for shoulder and scapula pain. SI1B is very important point. It comes here only, you can see the diagram, SI1B. The second phalange, upper side concave part, SI1B. It is very important for shoulder pain and scapular pain, backside pain. There are 2-3 points here. SI3 is very important again. You can see SI1C on the next page, 83. SI1C right and left. Second peritoneum, duodenum, SI2, inferior horizontal portion of the duodenum. Then SI3. SI3 you can see, treat for shoulder and scapular pain. Again, SI3 is very important point. Where it comes, it is, this is the line. We know this astronomical line. Upper side, the first astronomical line. The last means end of that astronomical line. Here is the SI3. Main point, SI3. You can put the magnet here, just at the end of this line. You can treat the scapular pain and shoulder pain. Then SI3 for veteral scapula, SI4 for, again SI4 is useful for treat for shoulder and scapular pain. Okay, come to the next page and see the diagram 84. Okay, come to the next page, 85th number. SI4 is for mesenteric lymph nodes. SI5 is second MP for the proximal wrist joint. You might be knowing SI5 point, original SI5 point comes here only. So this is SI3, SI4, SI5. This is SI5 at the joint, this wrist joint. That's why this is MP for proximal wrist joint. Okay. Then SI6 cervical vertebrae. Just now we have told. Then SI7 nerves for upper extremities. All the nerves of upper extremities treated by SI7. Somebody is having cervical spondylitis, along with that tingling numbness sensation in the finger, specifically this one, any finger. That is the nerves problem. So upper extremities, all the nerves can be treated with this single point, SI7. So in such cases, for cervical spondylitis, we have to use this SI3, SI4, SI6, SI7, along with, if the symptoms are there, tingling numbness or burning sensation in 2 fingers, 3 fingers like that. And it has mentioned, see, if irritation in the upper extremity is due to bone or tendons affection, treat urinary bladder. 11 number one, because UB11 is the influential point for bones. Okay. If nerves affection, treat SI7. Muscular affection, treat SI9. SI9 is exactly just 1 kun above the posterior axillary fold. Now SI8, treat SI8, CI3 and LI11 for tennis elbow. Anything with the elbow, tennis elbow symptom. There is a pain while any action, generally extension, flexion of the elbow joint. So use SI8, because SI8 is located here only. Just when we are seeing on the olecranon process of this radius. Allah.
Sir, can we give these on Beol also?
Yeah,
Like SI3,
SI4,
SI4, SI6 and 7 that you said for the nerve extremities. Can they be given on Beol also, or it has to be EAV?
Yeah, you can use Beol here, no problem. Beol meridians are, means I have seen in my practice also. If you are doing acupuncture, that is different. But in acupressure, if you are using Beol meridians, that is also best results.
Okay, thank you, sir.
Yeah. Even if it is acute pain or stiffness in the neck, so I have used 2 points, SI3 and urinary bladder 62. This is actually, I think you don't know that. It is in the 4th semester or 5th semester somewhere. There are 4 pairs of the points. If there is a problem of neck, then SI3, and along with that, if opposite sides urinary bladder 62 point, if you are using, then within few minutes, only within 5 minutes, patient gets relief of stiff neck, completely relief. SI3 and UB 62. If it is backache, stiff back, stiffness in the back or lower backache, if it is acute, just now it happened, like from 2-3 days or 6 days, 8 days, like that. So you can use triple warmer 5, TW5, and along with that, opposite sides, gallbladder 41, GB 41. These are very fantastic points. Only 2 points are enough to treat these conditions. Okay, we will go ahead. SI9, SMP muscle of upper extremities, including muscle of the arm and everything. A deficiency here indicates a tendomyositis or tendovaginitis of the forearm. And tendomyositis is inflammation of the tender muscular tissue. Okay. SI10 is 3rd MP for shoulder joint posterior portion. Again, SI10 is 1 kun above SI9 on the back side. SI15, anterior lobe of pituitary gland, also treat TW16 and GB21. You can see the positions, locations where SI15 is located. SI15 is almost the center of the shoulder here on the top, and above that, when the topmost portion and below backside. topmost portion of this trapezius muscle, that point is GB21, and just 1 kun below that GB21 there is triple warmer 60. All these 3 points combinedly can treat anterior lobe of pituitary gland. So these are also useful for detoxification. SI 16. It is useful for 10th cranial nerve. Which is that? I think vagus. Which is called vagus nerve. It is MP for that cranial segment. Treat here to balance the autonomic steering of the larynx. This for speech difficulties. Larynx, pharynx. Along with that, you can treat this UB10A, STC, ST8C, and ST8D. Okay. Come to the next point. SI 17. Fifth section of the mandibular bone, 8 odontone, lower wisdom tooth. Teeth problems because the locations they have mentioned here. It is entering, meridian is entering from the below of the earlobe and goes in, enters into the face up to the this maxillary bone. Then again it going backward and enters into the middle lobe, this middle ear, and then the middle of the lobe, ear lobe. Then again, SI 18 is CMP vestibulocochlear nerve. SI 18A is otic ganglion. Then SI 18B upper jaw. Then 6th and 9th odontome. Okay, page number 88. MP for external ear and external auditory canal. Any problem of external ear. Special note: according to EAV, this point is located at the middle of earlobe. SI 19 is middle of the earlobe. You can see here, middle of the earlobe. In the diagram on 87 number page, the center, almost center of the earlobe, where usually ladies are pricking for the ear rings. Now SVPA secondary vessel travels from SI. Okay, in nervous diseases treat SI and duodenum. Yes, we have seen already. Again, come to the page number 89. SI 2, SI 3, right side descending portion. Again, the same thing. ST45 is for MP for pylorus. This balances the acid-base ratio in the stomach. Is an alarm point for small intestine. CV4. CV4 is the alarm point for small intestine. CV4 is it's below. CV3 CV2 is above the pubic symphysis, the upper border of the pubic symphysis, that is CV2. Then CV3 is 1 kun above that, and CV4 is 1 kun above that. That means 4 kun below umbilicus, almost central line. Okay, we will come to the next page, 90 number, chapter number 8 now. Spleen meridian. Okay, we will see this. Spleen meridian is there on the left side only, and this meridian on the right side is called as the pancreas meridian, according to Dr. O. Location of spleen meridian is the same in Chinese acupuncture, and EAV in Chinese acupuncture is located on both the sides of the body, whereas in EAV it is only on the left side. Okay, there are total number of points in TCM 21, but here 6 points are additional. Okay, new point 6, so total become 27. Which are they 6 points? SP1A, this is a CMP of spleen. SP1A, again it's a different functions are there. The discovery of these points made possible to treat spleen, groin, and abscess, boils, any fungal infection, venereal diseases of the lower abdomen on the points related to lymph points. Now on page number 91, these 21 points are redefined. Rest 21 points are redefined according to Dr. Voll. So which are they? SP1 is specifically for white blood cells in the upper part of the body. Then SP2 is white blood cells in the lower part of the body. SP3 red blood cells. SP4 lymphocytes, monocytes, macrophage, and RES function. What is meant by RE? Can anybody tell me what is meant by RES? This is reticuloendothelial system. Reticuloendothelial system. In that macrophage means phagocytosis means any dead cells or any foreign body or antigen comes in, virus or bacteria, anything comes into the blood. This is the WBC macrophages. These engulf that matter, which is called as that activity is called as a phagocytosis. Phagocytosis. So it is basically the part of the immune system, immune mechanism, that is the reticuloendothelial system. SP5 is upper ankle joint. SP6 is very important point again. CMP, blood and bleeding. Anywhere bleeding in the body, anywhere, it's the MP measurement point for bleeding and blood. SP6. It stops the bleeding. SP6 sedation should be there. Even in menses, if bleeding is more, you can use SP1, liver 1, and this SP6. Very important. Excessive menstrual bleeding. Pelvic diaphragm. Then SP8 is for urogenital diaphragm. Means if uncontrolled urine or incontinence is there, you can use this one, SP8. Then again, the same thing is again repeated. Gonads, we have seen this, SP11 gonads. And SP12 lymphatic net of testicles and ovary. SP13 is lymphatic net of prostate and uterus. Then these are the lymph vessels. Then SP20 is the lymph nodes of lungs. If lung fibrosis or lungs problems are there, you can use this SP20 point also. You can select this one. Come to the page number 92. Through above stated points, different diseases of blood like increase or decrease of red cells, white cells, lymphocytes in blood can be treated easily now. Yes. Treatment on above stated various parts of the body and lymph points or organs can now easily get treated through these points. Various diseases like skin diseases, boils, abscess, nodules. Treatment for appendicitis can be given on PN 13A. This is right side. Prostate tumor on SP13 and venereal diseases can be treated on SP11, 12, 13 and 14. Venereal disease, it's a below part of the, this is a pelvic part of the abdomen. SP11, 12, 13 and 14. So it is important point for venereal diseases, treating venereal diseases. Now 3 number point, sympathetic steering of spleen. Stimulation of sympathetic steering of spleen increases secretion of spleen, increasing phagocytosis and production of WBC, RBC and lymphocytes, while a stimulation of parasympathetic steering of a spleen decreases the spleen function of phagocytes, production of WBC, RBC and lymphocytes. See the different things: sympathetic innervations, sympathetic steering of the spleen, and parasympathetic steering of the spleen. Sympathetic by splenic and celiac plexus by GB43C and GB44C, and parasympathetic K20 left side and K21 left side. So treatment on GB43C of spleen for the disordered steering of spleen can give very good results in the functioning of the spleen. SP1A left is control measurement point of the spleen meridian. Then this peritoneum, bleeding in any part of the body, treat SP6. Okay, we will see the functions one after another. Come to the page number 93. Again, it is white pulp of the spleen is responsible for irritation of the limb glands and the upper part of the body. White pulp means it is the white part of the spleen. Diagnose here a necrosis of the spleen nodule in diphtheria, fibrous change in follicles of a spleen with an increase in inefficient reticular lattice fiber found with morbus branti. It's a syndrome actually, morbus branti. Morbus branti. A deposition of amyloid in the follicles and reticulum cells. It's a disorder. Morbus branti is a disorder where the splenomegaly happens, and the early degeneration or destruction of the red blood cells is happening here in this syndrome. It's a blood disorder basically because of the spleen's function is deranged. Treat SP1 for following diseases of one or both the tonsils. When SP is the lymphatic ring of the pharynx, controls the white bulb. SP1 is the alarm point of spleen. Infection of any part of organ above from diaphragm of upper body. Treat SP1. Treat diphtheria, tonsillitis, pharyngitis, etc. SP1A is the CMP of the spleen. Then SP1B, peritoneum of the spleen. SNP. SP2, it treats the SP2 is the treatment of alarm point for infection in the anywhere below the diaphragm. Okay. Leukocyte response, white blood cells in the lower part of the body. This is a tonification point for the spleen meridian. Tonification point for spleen meridian. SP2. SP3, organ source point. We know it's SP3. Red blood function is a quality control of erythrocytes, red blood cells. Diagnose here hypertrophy of the spleen, then blockage of the veins of spleen in portal vein thrombosis. These are the different conditions: polycythemia, sinus filter. Okay. So come to the page number 96. One note is given. In that note, after all the three thrombosis, partial blockage, or complete blockage of the blood vessels, blood formation. So we have to use production of red blood cells take place in bone marrow. So treatment for reduced blood cells should also be given on the point number GB39. It is an influential point for bone marrow, and bone marrow produces all the red blood cells, white blood cells, all the things, platelets, etc. So along with this point, we have to use GB39. Now come to the next point, SP3A. This is NP for coagulopathy. Any blood clotting disorders, defect in blood clotting. You might be knowing in PHP why blood clotting happens, because of the clotting factors. Especially they have mentioned here hemophilia and anticoagulants caused by liver disease. So this is a complicated bleeding disorders due to the less synthesis of the clotting factor, less absorption of vitamin K, and abnormalities of platelet functions. Platelet causes the clotting. Prothrombin and these are activated in there. Now disseminated intravascular DIC can be treated here. There is one special disease. Okay, we'll go ahead. 97 page number SP4. Reticuloendothelial defense function of spleen can be treated by SP4. You can see here, this point is related to lymphocytes in blood. Monocytes and macrophages are formed here. Cat protein and bacteria are neutralized here. So this is very important point. On the right side, it is very important. PN1, PN2, PN3, and PN4 for different metabolism. Cat proteins and all. So deposits of amyloid protein, fat substances. If nodes of protein are there on the body, treat SP4, and if obesity increases, treat PN4. PN4 is used when obesity is due to the increase in fat. If fatty deposition is there and because of that obesity is there, you can use PN4 point. PN4. The right side, SP4. Then sphingomyelitis. Note RES reticular system is a widely scattered system of the cells of a common ancestry fulfilling many vital functions, which defends against infection, antibody, blood cells, and bile pigment formation, etc. RES is defined here. Now come to the page number 99. 98 is a diagram. Basically, one is capacity. So check lymphocyte level in chronic infection, new infection, and for prognosis purpose check ESR level. ESR, erythrocyte sedimentation rate. This is the ESR. Now here they have given what type of work each white blood cell is doing in our body as a defense mechanism. Neutrophils are like a walking soldiers. Walking soldiers. Eosinophils are like a cavalry. Cavalry means the soldiers on the horse. Then lymphocytes are like a artillery. The soldiers on the rangada or some big vehicles, and they are fighting. The big gun is there. Lymphocytes and monocytes are like the workers in a battlefield who clear the dead body of the soldiers who have gone or dead. So SP41, internal lymphatic vessel of the spleen, correct, lymphatic vessels. Then SP4A is the geopathic disorders. See what is this? This point is the diseases of the geographical regions and climatic diseases like jet lags, etc. From one geographical part of the continent to another continent or another region. Some diseases may occur. Geographical disorders, geopathic disorders. You can treat this one, SP4A. SP5, MP for upper ankle joint. Yes, we know SP5 is just located just near to ankle. So it's MP for ankle. SP6 and PN6, MP for blood. We know this, SP6, PN6. Along with that, we have to treat K7 and liver 5. These all the 3 points are just near to each other. Liver 5, K7 and PN6 or SP6. It stops bleeding in any internal organ of the body. SP7, PN7, uterus collapse. And because this is MP for pelvic diaphragm. Weakness of the fibroid tissue of small pelvis. This point lies 2 ends width above the medial malleolus. Yes, SP7. This is 3 ends, SP8. SP8, PN8, MP, urogenital diaphragm. It controls the anterior segment of the plate of the pelvic outlet. In female, it treats sphincter weakness of the urinary bladder. If incontinence in the female is there, then treat SP8 or PN8. Then diagnose in female sinking and collapse tendency is in advanced here. Yes. SP9, PN9. MP lymph vessel of lower extremity. Now this point is also useful because lymph vessel of lower extremity. Diagnose and treat a beginning or existing thrombosis of leg veins in the small pelvis and lower leg. Thrombosis, to diagnose thrombosis. SP9, you can use this along with CV9. It's conception vessel, CV9. To prevent any thrombosis in a pelvic or lower leg. Now, SP10, PN10, MP for pelvis veins again. Treatment on this point corrects the blood flow and circulation of the pelvis area. Now, SP11, we have seen already, MP gonads. Then SP11-1, MP for lingual lymphatic plexus, lymph vessel 1. SP11A, PN11A, second MP of hip joint, because it's located near to hip joint. SP12 in males, it controls lymphatic net of testicles, epididymis, and deferent canal. It's a part of a testicle, epididymis, and it's a deferent duct is there. Canal. And in females, it controls the lymphatic net of ovaries and uterine tube. Now come to the page number 102. SP13 or PN13. In male, it controls lymphatic net of prostate, seminal vesicle, penis, and urethra. And in female, it controls uterus, vagina, and urethra. These are genital organs. Special note. It is an important point for the treatment of prostate gland or boil abscess, fibroid urethra and gonads in male and or cancer of glands. And it is important for the boil abscess, fibroid of vagina, uterus, and ureter in women or cancer of the glands. Okay. SP13, very important. You can see on page number 103, the location, exact location of PN13 or SP13. Okay. 13A, iliac lymphatic plexus. Then SP13B, hypogastric lymphatic plexus. Again, any kind of infection you can treat this. That in that particular location or area. SP14, lymph nodes of gallbladder, lymph nodes of bile duct. Is important point for infection, wounds, nodes, fibroids, and growth of a cancer of the bile ducts or gallbladder. SP14. SP15, pancreatic lymph nodes for the lymphatic is an important point for the infection, wounds, nodes, fibroids, and hypertrophy of the cancer of the spleen and pancreas. SP16, gastroperitoneal pyloric lymph nodes, again lymph nodes. This is gastric lymph nodes. SP17, SP18 is an important point for the treatment of serious disease of the liver. Any serious disease of the liver, you can use this SP18, PN18. SP19 is phrenic lymph nodes, SP20 pulmonary lymph nodes. We are seeing already this in pulmonary TB or of the lungs or serious disease of the lung. We can use this SP20. And SP21 on the left side only. It is an alarm point for the serious disease of the spleen. Okay. So in this way, this ends the 8th chapter, spleen meridian. It is very important, spleen meridian. And on the right side, spleen meridian becomes pancreas meridian, PN meridian. It is also very important. Okay, we will begin with the 9th chapter, pancreas meridian. In EAV, right side of spleen meridian is called as pancreas meridian. Location, it's again same. But it is on the right side of the foot. According to points are now again, this is same. Spleen meridian, we are studying the spleen meridian only here. But the functions of the points on the spleen meridian on the right side of the foot are different from the spleen. Now the same points 21, but here 6 points are newly discovered. PN1A is the CMP for exocrine and endocrine function of the pancreas. Pancreas have endocrine and exocrine, both the functions. So again, SMP, peritoneum, MP, lymph vessels, exocrine, and all that. According to EAV, following points are redefined on pancreas. These are redefined points. Now PN1 on the right side, all the points are on the right side now. PN1 is the MP for albumin metabolism. Albumin is a part of albumin and globulin. These are part of
Protein.
Perfect. PN2 is the MP for uric acid, especially in the gout. Uric acid metabolism. PN3 on the right side, MP for carbohydrate metabolism, useful in diabetes. PN4 MP for fat metabolism. Fat means all the things now. Low density lipoprotein, high density lipoprotein, cholesterol, anything. Fat metabolism. These are very important points. PN1, 2, 3, 4. Very important point. We can use directly on the Voll meridian or directly on the foot main meridian. These are very effective. You can use 3 size or 4 size Voll magnets here. Now PN5, upper ankle, blood and blood bleeding, pelvic diaphragm, urogenital diaphragm, the same thing. Okay.
So PN 1, 2, 3, 4, do we sedate or tone?
Yeah, according to the condition we have to use. No? If the fat metabolism is interrupted, the function is not proper. That's why fat is accumulated everywhere in the body. So obesity happens. So we have to tonify the gland.
Oh,
Tonify that point so that fat metabolism will be corrected. So body's fat will get again redigested, and its use happen, and it will reduce.
And in diabetes?
In diabetes also,
So,
if in diabetes what happens, because carbohydrate metabolism or digestion of the carbohydrates metabolism is not happening properly, that's why it comes into the blood, because pancreas is not able to secrete the insulin properly, and
yes.
because of less insulin level, the carbohydrate metabolism is not properly happening. That's why glucose enters into the blood, is not into the tissue. So more and more blood sugar levels are increasing. So we have to tonify this again, so that metabolism will be corrected. In uric acid metabolism, sometimes if we know the uric acid crystals are deposited in that joints, especially on the right toe, big toe, and that joints, or somewhere, anywhere in the body. So uric acid metabolism we can tone, but if it is acute condition, painful joints are there, then we can first sedate this one, and then again, if pain goes, then start tonification. Again, the same thing with albumin metabolism. Now come to the, this is again same point from PN5 to up to 12, 13, 14, 15, 16, 20, same point. So the function is almost same. Now come to the page number 108. It has become easy to treat, easy and possible to treat the albumin, gout, diabetes, cholesterol, etc. due to the discovery of the points of albumin metabolism, uric acid metabolism, carbohydrate metabolism, and fat metabolism, pancreas meridian in EAV. Discoveries of the Dr. Voll about pancreas meridian and its related points would be a blessing for the mankind. Treat appendicitis on, again the same thing, appendicitis. Then pancreas meridian has one control measurement point, PN1A. It's a CMP. Okay. We'll go ahead. Page number 109. We'll see the functions here. PN1 is a protein digestion and metabolism, or albumin metabolism. Proteins supply amino acids, and amino acids build, repair, and maintain body tissues and are vital to everyday body functions. Correct? And then the body is not supply the proteins to repair the body cells. Proteins are needed for growth, synthesis of enzymes, plasma proteins, antibodies. This is just a BHB again. Excess proteins is excreted by kidneys as detached nitrogenous part. First class protein is found in the incomplete second class protein is found in cereals and pulses, bread and potatoes, etc. Protein is needed to fight viral infection. Pancreas produces proteolytic enzymes. So again, protein is required. Protein metabolism includes trypsin, chymotrypsin. These two are produced in duodenum of small intestine. They produce amino acids deficiency of this digest the pancreas itself. Pancreas, there is erythrin and proteases, these two hormones. Then pancreas protein zymogenesis, utilization of amino acids. Now this is a breakdown of the proteins into amino acids. Utilization of amino acids in the liver to synthesize albumin, globulin, prothrombin, and fibrinogen. These are again the production of the clotting factors which are produced in the liver. Its synthesis happens in the liver and it goes into the blood. Cell replacement, cell repair, production of the hormones, enzymes, and antibodies. For this, amino acids are required. Then treatment, albuminuria, that is albuminuria or albuminuria, K3. Okay, here was K3. Yeah, means we have to treat K3 point along with PN1 if it is albuminuria. Means albumin in the urine. In urine report, we can see that albumin plus or like that they have used. So we can use this K3 and PN1. When there is a low production of albumin, treat PN1 along with liver 3. If it is more, that is the albuminuria, K3 and PN1. And in low, PN1 and liver 3. Albumin is found in liver. It is the most abundant plasma protein in the globulin. There is a group of protein found in the tissues and it differs from the albumin in heat. Globulins work as an allergy resistant. Tissue deficiency, hemophilia, tetanus, and allergy, rabies, fibrinogen. These are the different things which means the factors which are very useful for different chemical activities in the blood. So it requires albumin and globulin. Proteins, these are protein. Fibrinogen is a soluble protein in the blood which produces non-soluble protein named fibrin. Fibrin makes the clots of blood to prevent loss of blood. It produces in liver, fibrin. Serum, after removing the red blood cells, the remaining liquid is called as serum. Clotting factor, these are substances which have coagulation of the blood. Treat problems related to albumin, globulin, fibrinogen, serum, and clotting factors here. All the problems of clotting factors. If prothrombin time is more, then blood clotting time is more, then we have to use this PN1 along with liver 3. Okay, treat disease of albumin metabolism here. Come to the page number 112. Protein metabolism, albumin metabolism. Again, the different points have given. Elaborate. Okay. Then PN1A, CMP for the exocrine and endocrine function of the pancreas. PN1A. So in diabetes, PN1A is also important and PN4 is also important. Okay, PN1B, SMP for peritoneum of the pancreas. PN2, uric acid metabolism and synthesis. PN2, uric acid metabolism. It is used for. Metabolism is responsible for nucleus production, nucleus protein metabolism, pancreas, nucleus. Okay. Special note, treat the gout. In gout, there is a hyperuricemia. Gout is a disorder, deposits of the sodium urate crystals which are accumulated in the joints because of high blood levels of uric acid. Okay. Most commonly affect right big toe. While treating gout, assess the tonsillar elements of the oropharyngeal cavity also related. Urea, creatine, and uric acid are formed in liver as waste products which kidney excretes with urine. Carbon dioxide is expelled by lungs. This complete system is controlled by PN2. So PN2 is very important. Uric acid metabolism in gout and hyperuricemia. So these are the some points they have mentioned. CI8E, right side 25, PN2 is sedation, uric acid metabolism. See, it is sedation is given, PN2 sedation. Along with that, allergies of lower half of body, AD1 sedation. CMP pancreas endocrine part, PN1A, tonification. Thoracic aortic plexus, CI8E, sedation. Liver 8, tonification. It is a tonification point of liver. And K1, sedation. This is the specific protocol for gout, uric acid metabolism. Then come to the next point, PN3, carbohydrate metabolism and digestion or diabetes metabolism. Carbohydrate metabolism is responsible for production of the amylases and maltoses enzyme. These enzymes disassimilate the carbohydrates. This is the function of the islets of Langerhans, islets structure in the pancreas. Islets apparatus is composed of 80% beta cells which produce the insulin and 20% of A cells which produce the glycogen. Okay. Special note, treat diabetes here. Carbohydrate metabolism, diabetes. This is very wonderful protocol for any diabetic patient. PN3 is it should be tonification for carbohydrate metabolism. Then TW1C we have seen already, triple warmer, or it is also called as a which meridian? Endocrine. So triple warmer 1C, endocrine function of the pancreas. It should be again tonified. AD1, allergy of lower half of body. Now allergies. So we have to sedate this point. AD1 and CI8. The circulation meridian 8C is abdominal aortic plexus. Yeah, correct. So it should be tonified. So tonification, sedation, and tonification. This is wonderful formula for diabetes. Now PN3A, next point. Wirsung's duct. It is a pancreatic excretory duct. Wirsung's duct is a pancreatic duct. Okay, you can read it out. This is the BHP study. Tiny acinar duct by protein metal eventually cause obstruction of the common bile duct, causing jaundice. Protein obstruction causes venous congestion. Okay, in such cases, you have to use this PN3A. PN4, fat or digestion and metabolism, or cholesterol metabolism. Come to the page number 116. Fat metabolism responsible for production of the hysteresis and lipolysis enzymes, and these enzymes disseminate the fat. Then bile produces strypsin enzyme. Strypsin enzyme activates the lipase, and strict liver and gallbladder bile measurement point, or fat metabolism. For fat metabolism, we have to use this PN4. And any illness of liver and gallbladder also. Special note, treat this point for high and low density cholesterol, any cholesterol type, high and low density. Also treat fatty degeneration vessel. Then PN4 controls the lipid metabolism throughout the body, high density and low density cholesterol. Again, they have given one wonderful protocol here. PN4, fat metabolism, SI1A right side, upper mesenteric plexus, fat D1B, fat degeneration of the organs and vessels of the whole body. Then ND1C, this is nerve degeneration vessel, meaning meninges surrounding the brain and spinal cord. Triple hormone 19 for meninges. This is a protocol.
So tone all of them.
Yeah, see here, PN4 should be tone, SI1A, upper mesenteric, it should be tone. Then fat D, it should be fat degeneration of the organs of the vessels of the whole body. Degeneration happened. So it is excessive. We have to sedate this point. Fat D1B. ND1C, meninges surrounding, it should be tone. TW19, it should be tone. PN4-1, MP, internal lymphatic vessel of pancreas. PN4A, MP, degenerative processes. PN5, MP for upper ankle joint. We know ankle is near to that SP5. PN6 for blood, we have seen already. K7 and liver 5 should be treated along with that. PN7, MP, pelvic diaphragm, again the same thing, uterus, blabs, all that. Everything is same, but we have seen in spleen meridian. PN9, lymph vessels of lower extremities, and indicated trough here indicates the beginning of the system thrombosis. Correct. Treatment on this point corrects the blood flow and circulation. PN9. PN11, MP for gonads, we have already seen. Along with that, PN11, liver 12 and ST31. Because they are at the same level, same location. Liver 12, PN11 means ST11 and ST31. The same location. Horizontally on the pelvis area, same location. But from the central line, it is 2 kun. Now PN11-1, MP, inguinal lymphatic plexus. Okay. Come to the page number 119. PN11A, second MP of the hip joint, it is near. PN12, lymphatic net of the testicles, uterine different canal in the male, and in the female, ovaries, uterine tube, and urethra. PN13, lymphatic net of the prostate, seminal vesicle, penis, and urethra in men. Again, the same thing is repeated here. PN13A, lymphatic. Treat this point in the case of the pus in appendix, yes, because appendix generally at the right side, iliac fossa. So PN13A is located just near to that appendix location. So if pus is there inside the appendix, you can treat this point. PN13B, hypogastric lymphatic plexus, lymphonoid. PN14, lymph nodes of the gallbladder and bile ducts. It is important point. Come to the page number 120. Special note, it is an important point for the treatment of infection wounds, fibrous cancer of the pancreas and pancreas. Same thing again, repeated. PN15 again the same thing. PN16 right gastric lymph nodes, same thing. PN18 lymph nodes of liver. Special note, it is an important point for the treatment of liver cirrhosis and disease of the liver, because see, it is on the right side. Again, the liver is on the right side. So liver cirrhosis and any disease of the liver can be treated by PN18. PN19 is phrenic lymph nodes. Okay. It is important for treatment of nodes. PN20 lymph nodes of the lungs. We have seen SP20, PN20. Both can be used in the TB of the lung or any serious disease of the lung. Means fibrosis, bronchiectasis, anything. So almost this ends the PN meridian also. That means we have almost covered these 9 chapters. I think we go ahead or not. It's only 5 minutes has remained. So we will see in the next class from 10, 11, 12, 13, like that. 4 chapters we will cover. Most probably. Up to kidney we will cover the points. Okay, 10, 11, 12, 13. We will cover in the next Saturday's class, and we will complete by next Sunday. If any difficulty you can ask. There are only 2 minutes remain. So next teacher will take the class. This is also very fantastic. Liver meridian, according to Dr. Human is TCM. This is wonderful liver. Wait a minute. Do you know about? I don't think you have this treatise number 6 in your syllabus for this 3rd semester. It is up to treatise 3, treatise 4, and treatise 5 is also included in your syllabus, I think. Treatise 6 is there. Can anybody tell me?
No, sir.
No, correct. Treatise 6 is there in 4th semester actually. So that time you can know that pair point, only 2 points can be sufficed to treat almost various disorders, spine disorders especially. This is called treatise 6 is based on 8 extraordinary vessels. That is called as EOV, extraordinary vessels. Is this 14 meridian we have seen according to TCM. Now according to Dr. Voll, again 8 tissue meridians. Now this is extraordinary vessel, EOV. There are again 8 meridians in our body. These are extraordinary meridians. The name, the word itself indicates that these are extraordinary. Means these 14 meridians work can be very easily and smartly we can do with the help of using these EOV, extraordinary vessels. So there are 8 points. 1 point is a master point in every meridian. There are 8 meridians, extraordinary. In every meridian there is 1 point, which is extraordinary point, means master point. So there is pair of in that 8 meridians. So only 2 points are suffice. One on the upper extremity, one on the lower extremity. 4 on upper extremity, 4 on lower extremity. So this pair can treat almost various diseases. It's very shortcut to treat by acupressure or acupuncture. We can see that in the next term, next semester. Okay, so I think it's almost time is over. We will meet in the next class, next Saturday, in the 9th class. We will see chapter number 10, 11, 12, and 13 of treatise 4, Dr. Voll's Electro Acupuncture. Okay, thank you very much, everybody.
Thank you, sir.
Today we will conclude this class.
Thank you, sir. Thank you so much.